Today I am going to talk to you about a very common condition seen in women, polycystic ovarian disease. It affects almost 20 women out of 100. It can affect your fertility, your menstrual cycles, your appearance, and also your long-term health. Having polycystic ovaries doesn't mean that you're having polycystic ovarian syndrome. Only 6 to 7% of women having polycystic ovaries will develop into polycystic ovarian syndrome. The symptoms of polycystic ovarian syndrome can include irregular periods or no periods at all, difficulty in getting pregnant, overweight or difficulty in losing weight, unwanted facial hair, oily skin, acne, and depression and mood swings. The symptoms can vary from woman to woman. It can be very mild or it can include all ranges of symptoms. What causes polycystic ovaries? Actually, the cause nobody knows. If anyone in your family, like your mother, your aunts, your sisters, has polycystic ovaries, you have a higher chance of getting polycystic ovaries. Basically, it is caused by abnormal hormones in your body, like testosterone level is high, insulin level is high. It's also associated with higher levels of TSH and prolactin. Higher levels of insulin and testosterone can cause irregular periods, weight gain, and acne. How is polycystic ovaries diagnosed? When you have infrequent or irregular periods and difficulty in losing weight, you approach your gynecologist and she would do an ultrasound scan for you, and the appearance of polycystic ovaries would be evident in the ultrasound scan, and the hormonal tests like testosterone and DHEAS can support the diagnosis of polycystic ovaries. Now let us see how polycystic ovarian syndrome can affect your long-term health. It can lead to diabetes because of your overweight and also high blood pressure. And the high estrogen level in polycystic ovaries can lead to cancer of your uterus, and also it can cause depression and mood swings. How can we treat polycystic ovaries? The primary treatment is a change in lifestyle. You have to have a healthy diet, regular exercise, and then only comes medical treatment. Your gynecologist may give you some tablets to control your insulin resistance. And also, in case you want to have a baby, you might need some assistance from your fertility specialist. Again, if the symptoms are not controlled by your change in lifestyle and your medical management, you might need a laparoscopic ovarian removal. In spite of all this, polycystic ovaries is not a curable disease. We can only manage your symptoms and the consequences. You need to have regular checkups at least every year. Your blood sugar should be checked to rule out development of diabetes, and also if you don't get your periods in 3 to 4 months, you would need to have an assistance from your gynecologist. We take a pledge, we will treat you well.